Morning, Jill.
Good morning.
We just took your braces off a week ago. I want to briefly do an update to see where we are and how we are when we met and so on. Can you briefly tell me, how are you doing?
I'm doing exceedingly well.
Okay.
Since the braces have been off, I haven't had a single headache. My jaw has not been popping or coming out of place. I'm having a consistent bite when I'm eating food, when I'm having conversation. So doing much, much better than when I started.
Okay. Back to when we started, and also I'm all the way here, speak up a bit.
Okay.
Back when we started, we first met you around Christmas of 2011. And tell me what all things have happened prior to it, briefly.
Prior to seeing you,
Uh-huh.
well, every time I would go to a dentist or an orthodontist, my brother had braces, so he would frequent the orthodontist and I would go with him.
It was Dr. Dorsch, right?
Yes.
Uh-huh.
I was always told that because of the size and shape of my jaw, I would need to get surgery on my lower jaw to have it moved back, so that I would no longer have the inconsistent bites. They said that would cure the headaches, that would create essentially an environment for my jaw to function like it needed to function. So ever since, I don't even remember, when I was very, very small, that was always the recommendation, was the only real fix for the problems I was having was to get my jaw broken and moved back.
Lower jaw backwards.
Yes.
Okay. When I first met you, you just finished college at Harvard, and you're in a Teach for America program at the time. So that would have been, what, 22 at the time? Something like that?
Yes.
Okay. So you're going back to at least 10 years prior to it, you're having headaches?
Yes.
Tell me about the headaches. How often did you have them?
Oh, almost every day that I would have multiple headaches. I got to the point where I could function with the headaches, but especially in high school and college, almost every day I was taking either medication for the headaches or I would take lots of naps and rest in between. But
Wow, how did you manage Harvard?
lots of naps.
No, I just didn't realize you were
Yeah.
that much headache.
Oh, absolutely. So, I mean, because it was so frequent, I got to the point where I could just say, okay, I have a headache. I remember my roommate would tell me the day that you don't have a headache because you're telling me every day that you do. So it was
Did you have a day that you didn't have a headache?
Eventually, I think that I started off the morning without a headache and told her that, and then in the afternoon probably had
That day turned out to be not a...
Exactly.
Oh, wow.
So it wasn't very frequent that I would not have a headache, and they would come in clusters and typically be located in the front over my eyes.
Okay. And you did have some medical tests done.
Yes, I had an MRI done because of the frequency of the headaches. And essentially they said there's nothing in your brain that's attributing to these headaches. It might be your jaw and your bite. At which point, again, we went to the dentist and orthodontist that referred us to having the surgery to break and move back to solve the problem.
Okay. And then you had more than one surgeon that said this.
Yes.
Also somebody in Vegas?
Yes. I went to get my teeth cleaned in Las Vegas.
Because you were there working
Yes,
as an
I
internist.
was teaching in Las Vegas.
Uh-huh.
And apparently the dentist's wife is an orthodontist, and she suggested the same type of thing.
So you're hearing consistently in Kansas City, Kansas, and Vegas, all the same thing, cut the jaw, bring the lower jaw back.
Absolutely.
Okay.
And I was told that's the only option that I have, given my circumstance.
And well, what was their recommendation based on? Is it a lot to do with the looks?
Yes, I never really had an orthodontist or a dentist do a detailed inspection of my jaw. I never had x-rays taken or a CT scan or an MRI or anything. It was typically just looking at me aesthetically. I have a pretty profound jaw, so they would see me in the office and that would be the recommendation.
Because of the lower jaw being long.
Yes.
So they thought that's okay. So then what led you to coming to see us?
I had back pain and I fractured my pelvis in high school, so I went pretty consistently to a chiropractor.
Dr. Ferguson,
Yes,
Frank Ferguson.
Dr. Ferguson. I went to school with his kids. And I told Dr. Ferguson about the headaches and the jaw pain, and he said, don't do the surgery. I've had multiple patients that did it and were not pleased with the surgery. Instead, go to Dr. Rahman. He's the only one that I've had people work with that are actually satisfied and feeling better at the end of their treatment.
Okay. Tell me about the various doctors that recommended strongly you need surgery. How did they determine this will take care of headaches?
That's a very good question. I'm not completely sure because they never really did full workups to determine what was happening in my jaw or with my teeth alignment. So it was typically they would see my face, they would hear the symptoms, and they would say, okay, well, the only solution is to cut and move back.
Okay. Surgery being such a drastic and irreversible step, that's why I was kind of making a point. So how do they know?
Yeah.
Okay.
Yeah.
All right. So tell me about the process. We started seeing you early part of 2012, and what did we do different?
Well, first, you did really extensive testing. I remember sitting in the chair with the different, I'm not sure what they were, the different patches on.
So the electrodes?
Yes,
Okay.
absolutely.
To measure the muscles.
To relax my jaw, to relax my facial muscles, to see what the natural alignment of my bite was. I remember being in the office and having multiple tests upon multiple tests. You even watched how I walk to see the alignment of the rest of my body. I remember getting a scan to see what my jaw naturally aligns to, and that you always had a full picture, but you always gave me a lot of information about what was going on and the implications as well, in a way that no other person I'd interacted with had ever taken the time to do.
Thank you. And then you were given options, because one of the things I talked about is aesthetics.
Yes.
Many people know I do a lot of aesthetic work.
Yes.
I'm a cosmetic dentist as well, but that was not a concern at all for you.
No, I assumed I would have to have braces, and I remember having that conversation. And I asked about Invisalign, and you gave me the pros and cons, and you said at the end of the day, the root of your teeth needs to move, and we want to make sure that what we're doing is long-term and lasting to improve your health. I remember at the onset, I said, I like my jaw, and I don't really want it to be broken and moved back. I'm fine with whatever changes need to occur to my face in order to solve the problems with these headaches that I'm having.
Yeah. The other thing you may remember, it's been a few years, is the implication of moving the jaw back and the tongue room and the airway and how that affects that would have had a disastrous consequence on your health.
Absolutely.
The oxygen, because the airway is more compromised, that is absolutely the wrong thing to do.
Yeah.
And I remember having the conversation. It made sense to you and Gail, your mom as well.
Yes, I remember that you showed me the scalloping on my tongue,
Uh-huh.
and I never had a conversation about why that.
What that
would
means?
occur. Absolutely. So you showed me the actual space that existed in the mouth, the optimal space that would exist in order to have enough room for my tongue. And we talked about the implications of moving my jaw back and my tongue that was already crowded, not having enough space. So yeah, you did give me a lot of information, but you were always very clear that there are multiple options, and you gave me the pros and cons, but enough information that I could choose.
Okay. Well, fast forward, we did several things. Primarily, we brought your upper jaw forward as best as possible using called a face mask. It had limited success because of you're grown by then, 22 by then, and you're also out of state. You're in Nevada teaching, and then you're in Los Angeles for a while too.
Yes, over the summers I worked in LA.
Right. So then we did braces and so on. So fast forward to this is August of 2015. Tell me briefly about the journey that you went through. Part of the challenges about different states and so on too.
Absolutely. So it has been a lot of work. Having the orthotic on the bottom teeth was something to get used to, was something to adapt to. That took a lot of time. And being out of state, because I wouldn't be able to come back and seek treatment unless I was back in Kansas City. But having the orthotic on the bottom, starting with the retainer that widened the top jaw that I would have to twist every once in a while, then the face mask that did attempt to bring my top jaw forward, then the braces to create some of the consistent spacing that we needed between my teeth to set the alignment straight. So there have been a lot of steps in the process along the way, even to the point that when you were doing a conference in Las Vegas, I came out to see you.
I was teaching, and then you had some little issue. Yeah.
To make sure that everything was still on track to where we need it to be.
Well, I'm glad you brought up the orthotic, because prior to doing any permanent treatment, we did the first step, which is, all right, the diagnosis is made, let's make sure this actually helps a problem. And you had the lower fixed orthotic, basically align the jaw or the diagnosed position before we did any moving.
Yes.
Did you notice any change at that time?
Oh, absolutely. Right away. The headache stopped almost immediately. It was challenging to get used to this fixed bite. That was quite different from the normal alignment that I had at that time.
What was your bite up to that point in your life?
Yes, absolutely. But the headaches were almost instantaneously gone, and I remember telling my mom, like, really? This was what was causing all of that for all of those years? I wish that we would have been able to go sooner, and I wish that we would have had the information sooner so that we could have sought the appropriate treatment when I was younger. But I'm glad that we came when we did, because I'm better now.
Well, at the very least, you didn't have the wrong treatment done.
Yes.
As many times as it was recommended, and I'm sure you were too. I'm glad it didn't go through the wrong treatment.
Yeah.
Granted, the right treatment took a little longer to get to. Okay.
Yes.
Anything else to add to people that may have been told, just like you were multiple times,
Yeah.
the only thing to do is jaw surgery? What would you tell such a person?
I would tell them to get more information, to seek more testing, to understand what is actually happening with the function of your jaw, to get options on the table. That if you're consistently being told there's only one way, ask why that's the only way, ask what the implications would be for other things. So if I were to get that surgery, implications would have been for my tongue, for my breathing, for my airway, and that was never part of the conversation. So I would encourage individuals that have been told this is the only option to get more information about the mechanics of what's actually going on so that you can have more options on the table for yourself.
Okay. Thank you.
Absolutely.